Hello everyone, I'm Dr. Wakabayashi, a regenerative medicine specialist. With that in mind, I'd like to discuss 5 things you must check at every step. First, has the clinic filed a notification for regenerative medicine and its provision plan? This might seem like a bit of a difficult topic to start with right off the bat, but stem cell treatment is regulated by law in Japan. So we submit a plan stating that we'll perform stem cell treatment for a specific disease. You can only perform stem cell treatment once it's been accepted by the Ministry of Health. Please check the clinic's website to see if it has been properly accepted. If this isn't listed, it's a clinic that shouldn't be doing stem cell treatment in the first place. I think checking whether they've properly filed this notification is the very first thing you should look into. Doctor, I have a question. Are there clinics that do stem cell treatment without filing a notification? Well, I'd like to believe there aren't any. Check number 2, it's about what the culture room is like. First, there's the in-house CPC. That means there's a culture room inside the clinic, but there are also cases where it's outside. As for which is better, in-house or external, it's a sensitive issue, so I don't think I need to go into it here. However, there is a difference in the strictness of the standards. I think this is something you should consider when choosing a clinic. Under Japanese law, it's easier to get a permit for an in-house CPC because a doctor is present. In contrast, an external CPC is considered a contract facility. So the standards for authorization are much stricter. Ultimately, it's up to the patient to choose which one they prefer. There are things I'd like to say, but can't talk about it here. To be honest, I don't think it's appropriate content for YouTube. If you want to know more, I think it's best if you come in for a consultation. Check number 3. It's about the doctors. If we start talking about qualifications or age, there's no end to it, so I think you should look that up yourself. There are actually many hospitals that list doctors on their website who aren't even in charge, so you should check the website carefully. I think it's a good idea to check if the doctor you want a consultation with is actually working there. Next, the 4th point, please be sure to ask how the cells are being managed. Cells are living things, so things like how those cells are being produced and how they're being managed are things you should definitely ask during your consultation. It would be very strange if they couldn't answer those questions. Some might say they leave it all to the culture technicians, but since it's something going into the patient's body, I believe you should receive treatment at a clinic that can provide clear answers. I'm talking about bacterial testing. If this isn't done properly, it could lead to incidents like the one we've seen. I think you should ask about sterility testing and how exactly it's being carried out. 5th point, does the hospital have a proper follow-up system in case something goes wrong? I think this is extremely important. If they can't handle an emergency, every minute is critical in an urgent situation. So whether they have a solid backup system in place for emergencies is something I think you should definitely ask about during your consultation. Actually, stem cell therapy is a treatment where nothing usually goes wrong. But even so, I think you should hear this just in case something does happen. So I've talked about 5 key points for choosing a stem cell therapy clinic. To summarize, first, is it a clinic that has submitted a plan for providing regenerative medicine? Second, what is the state of their cultivation facility? Whether it's on-site or off-site, is it a properly existing, solid cultivation room? Third, the quality of the doctors. Are they doctors who actually work at that clinic? 4th, the quality of the cells and the cell management system, and whether they are conducting thorough bacterial testing. 5th, is there a solid follow-up system in case something happens after treatment? These 5 points are what I consider important when choosing a clinic. By the way, at our clinic, I can answer all 5 of these points right away. Stem cell counseling is actually quite difficult. Since it's a new treatment, there are many people who don't understand it at all. I think it's even harder for the patients. And sometimes people just get the treatment because it sounds good, but it's an expensive treatment, so I believe it's best to understand it fully before proceeding. At our clinic, 1-hour counseling sessions are quite common. To be honest, I feel like I've only said about half of what I wanted to in today's video, but if you'd like to hear more, please come in for a consultation. There are some things that are hard to say on YouTube, so if there's anyone who wants to know more in detail, besides liking the video and subscribing to the channel, I hope you'll come in for a consultation. Thank you all very much for today.